At the moment, we have the challenge in Hodgkin lymphoma from a clinical perspective. Well, first of all, we have a very good situation that most patients do very, very well, and we're able to cure most patients. And we're very fortunate to be in that situation based on many, many decades of improving treatment. But we still have the situation that probably many patients at the moment receive too much therapy, so they receive more treatment than they need. And some patients don't receive the right treatment or receive too little treatment maybe, and those are the patients that relapse. So we have an issue of overtreatment for many patients and undertreatment for some patients. And with the idea of individualizing treatment further and giving each patient just the amount of treatment that they need to avoid any unnecessary side effects, which in the long term are something that's still very, very bothersome for our patients, and often side effects that are, very dangerous, like secondary malignancies or secondary cardiovascular consequences occur. And to do that, we need better tools to prognosticate which patient does well and which patient will not do so well. And at the moment, how we do this is we use mainly clinical risk factors, and we don't use biological risk factors so much. And I think this is something that really will change and should change. And there's more and more research coming out that there's more and more research understanding the biology of Hodgkin lymphoma better, the genetics of Hodgkin lymphoma, but also the microenvironment and how this plays together. And hopefully we'll be able to better identify patients with that when we diagnose them, have, for example, genetic alterations that are poor risk or better associated with a better outcome, like we have in other hematological cancers already. And this will help us to individualize treatment, but also then do things like MRD measurements, so use very kind of sensitive molecular tools throughout the course of treatment to really follow these patients in a very, very kind of tightly controlled and sensitive manner, and guide treatment together with imaging tools we have already, like PET, guide patients even better through treatment.